And I'd like to invite our patient and family ambassador, Heather Thiessen, to join me to introduce our final keynote speaker. Heather.
Thank you so much, and good afternoon. As you know, my name's Heather Thiessen, and I am passionate about patient and family-centered care. I'm proud to say I've been an advisor within the Saskatoon Health Region for the past 4 years. I can remember finding my voice at events like this, telling my story to frontline staff, many of them remembering the events I told them and understanding how I felt as a patient. I even had a few come up and apologize for what I went through. So important to me as I am on this journey for that next patient who is still afraid to share and come up with their own stories. It's not only empowering for patients and families, but also for healthcare workers. In many initiatives where patients and families participate, you can see thoughts and opinions change once we are asked how we feel. This is what will help make change stick. It is truly when we create and sustain partnerships between patients and families and staff that we will see changes we all need to happen in our healthcare system. We have done incredible work in this province and should take time to celebrate this. However, we must be willing to push that envelope and not be complacent with it. We currently have advisors assist with improvement projects, both locally and provincially. And I would like to see the number of advisories grow across our province. And I would challenge us to think about how we can further incorporate that voice of the patient at every level that will impact them. This is why I am so excited to welcome Leslee Thompson to this year's Quality Summit and how she has made changes at Kingston General Hospital. So Leslee has begun her career as a critical care nurse and has over 25 years in healthcare experience that extends from the bedside to the boardroom of some of Canada's largest public and private healthcare organizations. Leslee has won numerous awards for her contributions to nursing profession, her leadership on a national public service program, and for advancing a best practice in healthcare management. She is currently a member of the Board of Directors of Ontario Health Association and the Vice Chair of the Council of Academic Hospitals of Ontario. She is also the Assistant Professor in Faculty of Health Sciences at Queen's University. As President and CEO of Kingston General Hospital, and has led the organization through a major turnaround by focusing on patients and family-centered care. Leslee will help us better understand what patient and family-centered leadership looks like and what it takes to make patient and family-centered care part of the fabric of your organization. Please join me in welcoming Leslee Thompson. Thank you very much.
Wow. It's fantastic to see so many of you here today, and I really want to congratulate you for choosing to spend your time to come here, to be together, to learn together, and to fuel each other's passion about how you can improve the quality of care right here in Saskatchewan, and to deliver on your aspiration, your ambition, your plan for putting patients first right here in Saskatchewan. And I can't help but think of sessions like this where people come together from all kinds of backgrounds, roles, perspectives, that incredible things can happen. And I'm reminded specifically of a meeting that took place, a gathering of 64 people from 27 countries in Salzburg 15 years ago. And that group that was comprised of patients, families, caregivers, policymakers, academics, industry, these 64 people gathered in Salzburg, and they had a dream. And what they did was they said, our dream is to create a country that we're going to call people power. And so they imagined that world of people power where healthcare moved from the biomedical focus to one where people were connected with information, with empathy, compassion, and true partnership to improve health and healthcare so that their world, their land of people power could thrive. And at the beginning of the meeting, when they were determining what are the guiding principles for their world of people power, a Norwegian nurse put up her hand and she says, "Nothing about me without me." Everybody embraced that as the core principle that day 15 years ago, where people like Don Berwick were attending, and they channeled their energy in creating a plan and creating a vision for what things could be in the future when people are connected, and they were truly living the notion of a world of healthcare that was founded on the principle of nothing about me without me. I thought a lot about that world and the experience of coming together with ideas of people from so many different perspectives to make things not just build out the plan, but to actually think about how are we going to make it all real. I thought about that a lot when I first went to Kingston General Hospital in February 2009. Kingston General Hospital is an organization that's actually 175 years old. We're one of the oldest hospitals in Canada. There's been a long, proud history at KGH of people doing some really terrific things. It was founded on the principles of determination and people coming together when they had nothing, but they knew they needed to serve soldiers and others who were ill when there was no facility available. Everybody just did what it took, came together, and the doctors worked for free. And they came and they overcame a lot of adversity. And in fact, the character of the hospital is one in which it has overcome a lot of adversity over time. But around 2005, the organization, in hindsight, really started to lose its way. And in fact, in 2008, government was called in as an investigator to come because the organization was spending money that it didn't have. Finances out of control. Morale of the staff was low. Sick time was high. Infection rates were high. Complications from other clinical outcomes were happening, and the responses were not being mobilized to actually make things better. So the supervisor came in, or the investigator first, supervisor came in, made a series of recommendations, and there was a lot of very, very difficult things that happened over that year because the supervisor was asked to actually stay at KGH for a period of a year to start to get it on its path and its road to recovery. I was fortunate to be chosen as the leader to help bring KGH forward and move into its new future. It was a daunting task, and I can tell you there wasn't a big lineup of people that actually wanted to take it on. But still, I thought that this would actually be a really meaningful leadership opportunity because the organization I knew in its bones, nobody woke up in the morning and said, hey, we want to do a really bad job today. We want to harm patients. We want to be irresponsible with the resources that we've been charged with and have at our disposal to help improve the health of our patients and our community. So part of, in times like this, you need to go and actually search out and find that something from within people and figure out how you're going to mobilize the core that you know exists to help people move forward and find their strength. The old pick yourself up, dust yourself off, and carry on. But it's hard to do. So one of the things that I did first, knowing that we had a lot of work to do to actually fix some of the very big problems that were broken, things that needed to be fixed quickly, I hired a phenomenal chief operating officer, and that was a focus in terms of finances and operations at the beginning, because there was a lot of things that we just simply needed to address. We needed to involve and engage people in making that happen, so that it became about staff's perspectives as well as the new management. But then what I did was I set out and engaged with staff, with patients, with families, with the community, and I spent time meeting with almost 3,000 people myself. We know we needed an operational plan to improve, but I knew that thinking about, wow, we've got to balance the budget today, was not exactly going to be inspiring for anybody. So what we needed to do was figure out how we were going to come together and make a future that we could actually be really proud of. And so I didn't hire any consultants, figured that this was something that I, as a leader, really needed to do, to go out and be with people, to really get it in my veins of understanding how we could go forward. And I wanted to remember the things that I started to hear. Because I'll tell you, when you go and you're asking people to imagine a future and to think about what it's going to take to go forward, and you actually invite people to tell their stories about why change needs to happen, some of the stories were very hard to hear. I'll never forget being in one of the sunrooms in the nursing unit, talking with staff, and a nurse started to cry. And she said, I am so upset that I can't deliver the care to my patients that I know that they deserve. I'm missing equipment and a variety of other kinds of things, but she said, do you know what that feels like? New equipment can't just buy it. She says, I'm letting people down, and that is a terrible place to be. So I said to her and other staff, well, we need your help to actually figure out how we're going to do this. I don't have the answers. I'm not coming here as a white knight to save people. I'm coming here to work with you to figure out how we're going to move in the future. But the other really, really memorable, hard thing to hear happened in a room in a community center where we were talking with patients and families and asking them what it's like to be in a place where outstanding care always happens. What it's like, what does it feel like, what does it look like, what are the specific things that happen, and tell us about examples where that was so that we can learn and figure out how we can make that happen at KGH for every patient every day. And a woman stood up and she said, I just got to stop this here. She said, Leslie, I'm afraid to go to your hospital. I thought, afraid? You know, I'm a nurse, and I just, it's not okay when you hear that. It was distressing. I can understand when people might not like something, or they may be not happy with something specific, but to be afraid to go into my hospital, that's not okay. So I did what I did with the staff member. I said, okay, so would you help us? Clearly we have so much to do. We need to go forward, and would you help us? And around the same time, there were a few patients who were working their way through our patient relations process at KGH. And these were people who had had terrible experiences in our organization, heart-wrenching experiences. And we decided also to ask them whether or not they would give us the gift of their energy channeled toward change at KGH. They were skeptical. I said, yeah. You know what? I'm not sure. I don't know if I have energy to do this. And the team talked with them and invited 3 people to start, to form, well, we didn't even have a name for it, but we kind of morphed it into, over time, our Patient and Family Advisory Council. And these folks were just getting in place at the time where we were declaring what our strategy was going to be, that was informed by those 3,000 conversations and more, that set out the path of saying we are going to aspire, we are going to achieve outstanding care always. That's what we are going to do. We made our vision of our version of a country of people power. We made the KGH. We designed the headlines we wanted to see at the end of our time. We talked about what actions, what behaviors, what it would look like, what it would feel like, based on the words of folks that shaped that future. We declared a new mission for the organization to refresh, to re-engage, and reignite our commitment and connection to our core purpose. Because frankly, I felt that we had lost our way. We were an organization that somehow had forgotten that we were there for patients, and we were there to be with patients, and we needed to focus on the things that were most important. So the new mission that was crafted from this experience was that at KGH, we are a community of people working together to transform the patient and family experience. The community of people part was really key, because that's about connections, that's about coming together, a community with no walls. We weren't sure exactly how it was going to look and feel completely, but as we started to build the action plans that come as part of your strategy design and launch, the notion of transforming the patient and family experience, and we started to put things together, and then we kind of thought, it was one of our big aha moments, how can we, as the hospital, the staff, possibly put out a plan to say we're going to transform the patient and family experience without patients and families with us every step of the way? Like, how can you do that? We don't know how to transform the patient and family experience ourselves. We are an organization filled with 4,000 experts, but we are not expert in the experience and the lives of those who come to our organization for care. So what we said at that time was we made a declaration that any decision in our organization where the experience, where there would be a material impact on the experience of patients and families, any decision like that, a patient was going to be at the table. Now, we had no clue how we were going to do this. We were scared, but in a good way. We were kind of like daunting. I still remember with the board and saying, like, okay, are you with me? Because this is big. Once these words come out of our mouth, we have to make them real. So we set forward. We had our Patient and Family Advisory Council. That was a start. We went to them for advice, and by this time, at the beginning, as the launch of the strategy, there were 12 folks around the table. They designed their terms of reference for the Patient and Family Advisory Council. It was co-designed before we even knew what co-design was. And they started, and they focused on things, they wanted to focus on things that were going to help bring our strategy alive, because they helped shape it. And so it was about making it real. So then we started to keep asking ourselves, what would be different if patients and families were at the table? Well, simply everything. So we then started to look and learn from new perspectives. And one of the very first things that happened from as we invited fresh eyes and looking at the traditions and the practices within our organization is one of the conversations at the Patient and Family Advisory Council. They said, now, can you explain visiting hours. What's with visiting hours? They described circumstances and experiences in their own families that they had come, been shut out of care, being asked to leave the room, and they said, you know, you say that guy Don Berwick, a quality guy, you know, he talks about the fact that we're not there for others, but we are guests in our patients' and families' lives when they're with us in the hospital. It shouldn't be like they come in and all of a sudden everyone has to do everything according to our rules, our practices. And when we started to look at our practices, they were pretty darn provider-focused, especially when it came to something as simple but critical as visiting hours. And one of the things that we came to keep realizing is that every decision like this, when you say we're going to have visiting hours or something like this, it speaks volumes to those around you. So we said, fine. And we eliminated visiting hours. Done. First big thing that happened with the help of our patient experience advisors. Not everyone was really keen on that initially. But when we looked at it and through their eyes, and now part of our practice now is shaping every policy change with the voice and the experience of patients and the impact on patients, it started to make sense. Now we don't have a visiting hour policy, we have a family presence policy, family presence guidelines. Even our language has started to shift because language shapes culture. And when you have patients and families at the table, the conversations start to change. When a patient is then part of the patient flow task force, which used to be that group that would meet, and I think we've been meeting for like 30 years in my career trying to get a patient from the emergency department up onto the ward. Why is this so hard? But when you've got a patient sitting around the table in some of the sacred backroom conversations, all of a sudden you're not talking about ALCs, you're not talking about bed blockers, you're not talking about bed 25 if you could only boot them out early. The patient's at the table, a face, a life, and it starts to then shift and change some of that conversation. One of the other pieces of feedback that our patients and families gave us early on was about the professionalism and of our staff. And that really boiled down to, I don't want to know what it's like here in Saskatchewan, but in my hospital 4 years ago, you couldn't tell a nurse from a doctor, from a housekeeper, from a porter. And this, from a patient's perspective, was really distressing. So we started to unpack the problem, and what they said was, look it, how about name tags? So we started with, they said, so we redesigned the name tags. Big name, first name, last name, and role. But then the patient said, well, you know what the staff do when they're wearing their name tags, even when you tell them to wear it? They flip them over. And what's on the other side? The code for fire, missing patient, bomb scare. This doesn't exactly inspire confidence. So, what did our patients say? Put the name on both sides. So the name is on both sides, and it is a policy now of Kingston General Hospital. You must wear your name tag up chest height where people can see it, and it's part of the dynamic now of people knowing who everybody is and saying, hello, my name is Leslee. This is my role, and this is what I'm here to do with you. And that became part of one of the 5 standards associated with the model of patient-centered care at KGH. And the model had been emerging. We'd been implementing it over the course of the first couple of years and starting to take hold. But we then had to keep introducing the specific standards and monitoring about how we were doing with that. And even though we were making progress, and there were some excellent initiatives underway, our infection rates, which were the worst in the province when I arrived. We're still very poor. Our hand washing compliance was embarrassingly low. And then, well, we seem to be doing a lot of things right. So then we actually had a circumstance where a patient, I'll call Brian, died in our hospital of C. difficile. He was 43 years old, he came in for routine surgery, and he didn't leave our hospital because we didn't wash our hands. He died at our hands. And that November, when that happened, I just said, you know, this is not okay. So the first time in my career as a leader, I lost it. And I called our 150 leaders together, and I said, you know, I started out as a nurse caring for every patient, or every individual patient. My responsibility and accountability as your CEO, I'm accountable for the experience and the outcomes of every single patient in this organization. But most importantly, I've been counting on you and you've been counting on me because we signed on together to Outstanding Care Always. We said that we believe that every day that we're here to eliminate a preventable harm. That's what we committed to ourselves and to the people that we serve. And we have let them down. We've broken a trust, and it's not okay that we don't wash our hands. And so I said, we reiterated the policy, we reframed the guidance around that, the expectation. There's a lot of evidence to say you wash your hands before you enter a patient's room and you wash your hands afterwards. Non-negotiable behavior. Non-negotiable. So I actually found myself saying, just kind of came out with all the doctors, everyone else there, if you don't like this, if you don't think that you need to wash your hands to keep our patients safe, then I welcome your resignation. And I don't care who you are. And out of that kind of losing it thing, what happened was incredible because people kind of reconnected again with our meaning of eliminating preventable harm, Outstanding Care Always. There was all kinds of things that started to happen, but we went back to our Patient and Family Advisory Council, and I said, okay, we need your help on this. Our hand washing rate was 34%. Not okay. So what they said is that we needed a poster, and they made a poster that then went on every unit and in front door of every place you walked in the hospital. You can find these just clean hands that give the hand washing rate of that individual unit and the hospital overall every month. So we now have a consistent performance after measuring every unit, every category of staff relentlessly for 3 years. We have steady performance for the past 3 years at 95% hand hygiene compliance. Our patients, never in my career would I have ever thought I'm the CEO and my organization wash their hands. You know, but I'll take it because this was a vital behavior. It turned out to be a vital behavior because it reconnected people. And again, if you focus on the purpose, you remind people of where they are, you're partnering with patients to have ideas and empower them with the knowledge. When they walk onto a unit and they see 60%, that means 4 out of every 10 interactions that they're having, somebody's choosing to harm them. And they also agreed that's not okay. And together, we have moved forward. And we are relentless. If we start to slip, we focus again. what it also reminded me of that experience with Brian and the gathering together of the leaders was how important leadership is and the accountabilities that also go with this. You can't wish this. You can't just say, let's partner, let's come together, let's be in a room together and just make it so. And I believe that maybe that was going to be enough, that the vision would be compelling enough, that people would just want to do it and get on board. But what we decided to do was really focus on embedding the change, the expectations, the accountabilities, and think about patient-centered leadership as actually a practice that would contribute to the culture shift within our organization. So that leaders were not the ones that would ever be in the position of saying about kind of being the compliance managers or checking off a checklist to see if things have been done. They needed to be actively engaged in this whole piece. So what I did, and I actually started to frankly feel a little bit left out because things were going really well, and I said, well, what am I going to do now? I've got to be, in terms of the leader, what can I contribute myself? What can I bring to the situation? So developed a model, really simple, that we call patient-centered leadership. And that model has 4 parts. I like checklists. I like to keep things simple, but you got to have ways to go forward. So there's 4 parts I want to share with you that are around patient-centered leadership that I would offer up simply to say to you, maybe it's worth a try as you go forward yourselves. So the first piece of patient-centered leadership is about sharing stories of when people are making a difference in the patient and family experience. I believe that sharing stories helps shift cultures. And it's not just about a story and leaving it out there. It's about the leader not only inviting patients and families and others to tell their stories to others, but as a leader, say, I saw George talk with a patient today. I noticed his smile. I noticed how he offered up a glass of water, really addressed making that patient feel terrific. And I noticed that experience, the difference he made, really mattered to that patient. And I describe that story and pass it on. And that sharing of something that made a difference to someone else is part of making sure that these isolated acts and experiences don't simply stay unnoticed, because you can start to feel good and you can learn a lot from these sharing of stories. The second piece, and it has to be something that's connected to the mission that's going to help people move forward. The second one is seeing people and not just the numbers. I don't know how many of you have to look at numbers, pages with numbers, charts with numbers, reports with numbers. We do a lot of that. We've got patients and families that are on our infection control committee. They're on now. We have 68 patient experience advisors at Kingston General Hospital. And our patient experience advisors, when they're there, they're kind of looking, and as we think about something that we now call peopleizing the numbers, we now don't get excited about a 0.8% improvement in infection rates. What we get excited about now is asking the question, based on what a patient had said to us, so how many people came to our hospital this month without an infection and left the hospital with one because we gave them one? That peopleizes the numbers. That creates meaning. That creates connection. Peopleize the numbers. And if you can't peopleize the numbers, then get rid of the damn numbers, because they probably don't matter. The next piece is to include patients and families at every turn. we made a commitment in our organization that every decision where there's a material impact on the experience of patients, a patient will be at the table. There are now 65, 68 patient experience advisors in our organization. In fact, one of I was down in the US accepting an award on behalf of our organization, and the fellow who introduced me, he says, we've got to go down to Canada, or up to Canada and to Kingston, because at KGH they're letting the patients run wild. And while I thought, we're really proud of how much we're including and engaging everyone, but it did speak to something that I know people sometimes hold inside and say, like, oh my God, they are going to come up with all these ideas we can't implement. Or they are going to come up with all these crazy radical things that are going to turn everything upside down. Well, I'll tell you, we've been able to implement almost everything that has come forward. The ideas are not always rational in terms of things that we would have thought of, but they are turning our world upside down, and that is a very good thing. And so we now, every program committee, every committee of our medical advisory committees, our task forces, our hiring committees now have patients on them so that they can help choose the future staff of our organization, so that we can penetrate and make the thinking real every step of the way, including a patient. There won't always be the chance to do it in person, but you need to find a way to tap into that voice and bring it to the table and make sure that it's present. But I will tell you, when the individual is there, the power of that is remarkable. The final piece is asking yourself, what did I learn from a patient today? When no matter what your role is, if you're a patient, a family, what did you learn from another patient today? What did I learn from a patient today? Now, when I go on rounds throughout the organization, which I like to do on a regular basis, that's the question that I ask staff. That's the question, the conversation we have in our executive teams when we have our meetings. What did you learn from a patient today? And then how are we going to apply that learning and actually help make a difference? And then you share that story, and the cycle begins again. So you're sharing, you're peopleizing the numbers, you're seeing the person through all the numbers, the numbing reports, and everything else that are part of the day that we create. And now it's about peopleizing the numbers and seeing people for who they are, including patients, including the voice at every step, and then sharing it all once again while asking yourself, what did I learn from a patient today? Step by step, experience by experience, our organization, it looks and it feels different today. I can tell you, we didn't plan it all out. We didn't have all the answers when we started. In fact, a big part, and people say, oh, well, where's the book? Where's the plan? Like, we're barely even writing it down now. We're trying to get it together to be able to make sure we're very open and wanting to share with people what we've been doing, how we've been learning, in exchange for what we can learn from others. We partnered with an organization in Georgia region in the US that were doing magnificent things, and they have been like our coach, our mentors, our supports, and we go back and forth. And that's really important, to keep learning from each other, keep challenging each other to be better. It does look and feel different, and that's what patients and families and our staff are saying now. Partnering, though, is not easy. But what are the conditions for success? So some people say it takes courage. I'm not sure about that one, frankly, because when I think about courage, I think about doing something really big. Frankly, when we're talking about treating each other with compassion, bringing the humanity into healthcare, washing our hands, introducing ourselves and saying, hello, my name is Leslie. What matters to you today? I don't think that takes courage. I think it takes will. I think there's something inside that each and every one of us have to step up and step out and say, I am going to choose to make a difference. I am going to open myself up to learning and leading in a new and different way. And it's uncomfortable because people like me and physicians and many of you, we're brought up to think we've got the answers. People are counting on us for the solutions. We're here to do for patients. We're going to do things to people. We are going to make you better. We're going to fix what's the matter. And now what people are saying is, no, we got to focus on what matters to people, what matters to our patients, and open ourselves up to the experience of being a partner. I do think patient engagement is one of the most disruptive forces in healthcare today. I think it's changing and shifting the very foundation on which we are building a new future. And I welcome and embrace that change. And I really encourage you as well to think about what you can do to contribute to the disruption, contribute to the learning, and to contribute to creating an environment where true partnership with patients and providers can flourish. So, staying true to your dream, your ambition, your aim. In Saskatchewan, you've got patients first. That's a great start. You got to live it every day, every patient, every day, every act, and have the will to hold that as your standard and do not compromise. The culture of continuous improvement is about when you trip up, when it doesn't go so well, you learn. You learn together, you support each other, and you carry on. Because you've got to keep moving forward. Sometimes it's going to feel like you're moving back. But keep forward. Depend on each other. Fuel each other. That continuous improvement mindset is essential for getting to this new place. The learning together, the learning with each other, and keeping things authentic is also true. When I hear about patient and family advisory councils, and I've had the opportunity to meet with a number of patients and families here today and over the course of this conference, and it's fantastic. What I hear from patients across the country and from staff, though, is sometimes a struggle to keep this authentic. You've got to be true to the reason why you're bringing people together in the first place. This is not about decoration. This is not about ticking it off the list and saying, I have one of those at the table. This is not about tokenism. Partnership means bringing yourself all in to this new way of working. And it's hard sometimes, but you must be true, because if you're not, everybody sees it. And trust is built from truth and transparency. And the truth of saying, not only am I going to speak it, but I'm going to live it, is key. So you need to keep it visceral, keep it visible, and make it real. Don't look to anybody else up there, around you, beside you. It starts and finishes with each and every individual. I can absolutely tell you that that is the thing that makes the most difference going forward. And speaking of going forward then, what's next? What's next for you? What's next for this whole shift and change? Well, I'm really encouraged by what I see here, what I've learned so far from you and from your Quality Summit here, from the work you're doing in your regions and together in your institutions, your organizations, in your community, and coming together at a place like this with patients included. It's a great start. So keep it up. You're really on the way. But you gotta double down and make it real. So I think about looking forward. I actually think, well, what really needs to happen? And it's quite simple. I like to think about Jean-Luc Picard, captain of the Starship Enterprise. And Jean-Luc Picard, he prepared his team. They had the equipment, they had their training, they had their teamwork. They were a very diverse group. And they set out to go where no person has gone before. And everywhere they went, they learned. They learned from the people they met, and they always worked to learn and create new. But there's one specific part about Jean-Luc Picard that I really like. And it's that before he sets out with every journey with his team, and they're in their starship, and they all sit there together, and he says one word: engage. Engage. I think that's what it's all about. So my ask of you and my hope for you is together, engage, and enjoy the adventure of going forward that you are creating together to achieve your version of the people power nation, of lands where no people have gone before, and to keep learning from others, engage, enjoy the journey, and I am so confident that you will reach your destination where patients first is a reality for every individual in Saskatchewan every day. And I'll be watching. Thank you.